Okay, good afternoon, everyone. Today we are going to be talking about the pectoral region. Okay, that's the chest region, all right? So, the pectoral region is the anterior thoracoappendicular region that connects the upper limb to the axial skeleton. It forms the anterior wall of the axilla, houses muscle responsible for powerful limb movement, contains major blood vessels or major vessels and nerves entering the limb, and contains the mammary gland, that's the breast. Now, functionally, it is a transition zone between the trunk and the limb. All right. Now, let's look at the surface anatomy. What are the important landmarks of the pectoral region? We have the clavicle. Okay, the clavicle is one. We have the jugular notch. Okay, the clavicle jugular notch. The sternal angle of Louis, as the sternal angle of Louis, which of course in the second rib level we have the nipple, which is the fourth intercostal space in males, an anterior axillary fold, this fold here formed by the lower border of the pectoralis major muscle. Then we have the dectopectoral groove, which is of course between the deltoid and the pectoralis major. Now the cephalic vein runs in the dectopectoral groove before piercing the clavipectoral fascia. All right, before piercing the clavipectoral fascia. Now, what are the layers of the pectoral region? From superficial to deep, we have the skin. The skin, we have the superficial fascia. The superficial fascia contains variable fats. It contains mammary gland, contains cutaneous nerves, and even superficial vein. Then we have deep fascia. The deep fascia, also known as the pectoral fascia. All right. Now, then we have the pectoralis major muscle. We have the clavipectoral fascia. We have the pectoralis minor muscle, and of course the subclavius. Then we have the axillary vessels and brachial plexus. Then ribs and intercostal muscles. All this we are still going to come across it in our subsequent lectures. Now, the fascias of this region. What are the fascias of this region? We have the pectoral fascia. This pectoral fascia covers the pectoralis major muscle. It covers the pectoralis major muscle continuous laterally with the axillary fascia. Okay, attaches superiorly to the clavicle, then thickened inferiorly to form the anterior axillary fold, this fold around here. Now let's talk about the clavipectoral fascia on its own. A very strong and a deep fascia sheet extending from the clavicle to the axillary fascia. It divides into two, splits into two to enclose the subclavius muscle and the pectoralis minor muscle. So you expect it to form the costocoracoid membrane, between which is this costocoracoid membrane is between the clavicle and the pectoralis minor. Then we have the suspensory ligament of axilla, which of course pulls axillary fascia upward. Now, what are the structures piercing this costocoracoid membrane? The structures that are piercing it, we have the cephalic vein, we have the thoracoacromial artery, we have the lateral pectoral nerve, and then we have the other one, the lymphatics. Okay, now what are the clinical importance? Very important. It actually acts as a barrier to infection, infection spread. And it's actually very, very important. It's an important landmark in surgical dissections. Now, let's talk about an important stuff, which is the muscles of the pectoral region. They are divided into superficial and the deep group. Now, the first one is the pectoralis major muscle. This muscle is very large, looks like a fan. So we say a fan-shaped muscle that forms the anterior axillary fold. This fold right here. Okay, so it's supposed to be originating from the medial half of the clavicle. That's the clavicular head. Then the sternum. It also has origin from the sternum. As you dissect in the lab, you'll be able to come across the origin. So part of it is coming from the medial half of the clavicle, that's the clavicular head. So part of it is coming from the sternum. Part of it is coming from the costal cartilage of the rib 1 to 6. And then part of it is coming from the aponeurosis of the external oblique. Okay. Now, it all insert into a place, the lateral lip of the intertubercular groove of the humerus, or what I told you to also be called intertubercular sulcus. Okay. Now, what are the fiber arrangement? We have the upper fiber descending laterally. We have the lower fiber ascending laterally. Then the tendon twists before they insert. Their nerve supply, even though we have not spoken about the brachial plexus, their nerve supply is coming from the lateral pectoral nerve, which is C5 to C7, and also the medial pectoral nerve, which is C8 to T1. And what are their actions? Important. In adduction, ADD, to bring together, adduct, medial rotation, okay, medial rotation. Then it also involves inflection, okay, flexion, but it's only the clavicular head of the pectoralis major muscle that is responsible for it. Then also it assists forced inspiration when arm is fixed. When you fix your arm and then you try to force yourself to breathe, so it comes to play. And of course, you know, the pectoralis major muscle is a common site for muscle flap, and most times there is also atrophies in pectoral nerve injury, and then of course in athletes too we can have hypertrophied pectoralis major muscle in athletes. Then there's another muscle called the pectoralis minor muscle. This one is triangular. Remember, pectoralis major muscle, it looks like a fan. Now this one is triangular, so it's a triangular muscle that is deep to the pectoralis major. Just pectoralis major muscle is covering it. And what is the origin? The origin is simple. It's not as complicated as that of the pectoralis major. The origin for pectoralis minor is from rib 3 to 5 near their costal cartilages. And insertion too is very simple. Although the insertion of pectoralis major muscle is also simple. The insertion of this one is to the medial border and superior surface of the coracoid process. Remember the process I call the prostitute process. Okay, now what is the nerve supply? The nerve supply is coming from the medial pectoral nerve, and the action involves stabilizing the scapula and draws the scapula anteriorly and inferiorly, and also accessory muscle of inspiration, just like we have the pectoralis major muscle, an accessory muscle to force inspiration. Okay. What are the clinical notes to this? Well, it divides axillary artery into 3 parts, although this is for descriptive purpose. Okay, it divides the axillary artery into 3 parts. Okay, and that is actually a very important landmark in axillary surgery. Whenever a surgery has to be conducted, is very important. Then there's another muscle called the subclavius. If you remember when we were talking about the muscles of the clavicle, I told you that there is a groove called the subclavian groove beneath the clavicle for a muscle called the subclavius. It's actually a very small cylindrical muscle that is beneath the clavicle. Like I told you the last time, it originates from the junction of the first rib and its costal cartilage. And insertion too is simple. Insertion is to the inferior surface of middle third of the clavicle, and it gets its nerve supply from the nerve to the subclavius, which is directly from the brachial plexus. That is C5 to C6, if I can remember. I'm not that sure, but maybe you can check it up. I think C5 to C6 or C4 to C6. Okay, what is the function? It functions to anchor and depress the clavicle. Okay, and of course also protect the subclavian vessel. Now let's talk about the vascular supply. That's the arterial supply. Now, for example, primarily the vascular arterial supply is from the axillary artery through the thoracoacromial artery. That's the pectoral branch. The thoracoacromial branch has a pectoral branch. Actually, it has 4 branches: A, P, C, D. Apical, pectoral branch, clavicular branch, deltoid branch. So the so this supply is from the thoracoacromial artery through the pectoral branch, and also we have the lateral thoracic artery, and then we have secondary contribution from the internal thoracic artery, that is the perforating branches. Now, talking about the venous drainage, okay, we have the cephalic vein draining the pectoral region. The cephalic vein drains into the axillary vein. Then we also have the axillary vein, which continues as the subclavian vein. What about the nerve supply? Well, nerve supply is actually from the brachial plexus. Permit me, I'm going to do a video on the brachial plexus later on. So for the pectoral region, we have the lateral pectoral nerve, which supplies the pectoralis major muscle. Like I mentioned, we have the medial pectoral nerve, which pierces the pectoralis minor muscle, supplies both minor and major. And then we also have cutaneous innervation, of course, which is from the intercostal nerve. That's the anterior and lateral cutaneous branches.